So blood cancer is a uncontrolled proliferation of white blood cells. Sometimes it can be red blood cells or platelet also. So when these cells stop dying, they start getting accumulated inside the body, and that's where the symptom starts coming up, which means if the WBCs are proliferating rapidly, it will eat up the space for red blood cells. So if you don't have red blood cells, you start feeling weak, fatigue and tired. If you don't have platelets, which are normally produced, you start having bleeding. And these white blood cells, which are like uncontrolled, they can't fight with infection. So you get predisposed to infection. In a nutshell, blood cancer can happen to anybody at any point of time, from birth till the time you die. So there are many causes for blood cancer, namely, predominantly your lifestyle, pesticides, herbicides which we use, pollution. But in a nutshell, can I pinpoint one cause like smoking for oral cancer? Can I pinpoint one cause like papilloma virus for cervical cancer for blood cancers? The answer to that is probably no. It's a sum total of environmental issues which can lead to certain times predisposed people to get into having a blood cancer. So predominantly the lifestyle has to be improved, environment has to be improved, benzene-like products, pesticides has to be avoided. These are the commonest things which has got some linkages for blood cancer, but as such there is no concrete reasons why people develop blood cancer. So blood cancer can present to you at any time in any form. Just fatigue, just back pain, just body pain, fever at night, night sweats, weight loss, which is very, very common and which has overlap with tuberculosis and other diseases, and people keep on thinking it's a tuberculosis. Lymph node swelling, uncontrolled cough for 3 weeks, fever for 3 weeks, weight loss. So these are all common symptoms for tuberculosis as well, and we keep on treating for them, but this could be symptoms for lymphoma. Similarly, bleeding. When platelets are low, bleeding can happen. Other than that, what can happen is back pain. So multiple myeloma can present you with a back pain. Why we are saying is blood cancer is a conglomeration of say 250 types of diseases. So it encompasses many diseases of red blood cells. So red blood cells goes up, you can have stroke or a problem in the veins. You have got platelets going down and up, you can have problems like bleeding. Again, a stroke can happen. And the white blood cells you can have present with you to the doctor for the first time with infection as such, weight loss. So these are the commonest things where the blood cancer can present to you. In children, symptoms can be entirely different. Failure to thrive, recurrent infections, blood vomiting and bleeding spots over the body. These could be the early signs. And in pediatrics, very commonly what you see is a bony pains in a kid which has been long lasting, and predominantly this happens at night time. So it comes in various forms. It comes in various shapes. One has to be cognizant of this fact and has to decipher these signs which the body tells you that something is wrong, which doctor and you together has to pick it up early for that, so that blood cancers can be treated early and cured in vast majority of people. It's very simple. You don't require robust or you don't require big machineries to diagnose it. Simple thing is first to know it. First you should have a knowledge of it. Your doctor in the periphery, when this telecast goes to millions of viewers and millions of doctors sitting in a tier 2 and tier 3 cities, any symptom you should think of blood cancer, what I've just named it. One. Second, simple test called complete blood count. CBC test is the gateway for early diagnosis of blood cancer. Think lymphoma if you have got lymph node swelling. If you have a back pain, think myeloma. Unexplained renal failure, think myeloma. So these are the commonest ways. A simpler test like blood test which has to be done, followed by a bone marrow test, which is again a simpler test, not very expensive these days. A slight pain does occur, which is taken from the bone, because bones inside the bone are the factory for producing the red blood cells, white blood cells and platelets. So you go to the factory and see what is wrong in that. Third thing is the PET scan. PET scan is utilized for multiple myeloma and lymphoma to see the extent of lymph nodes involved in the process of lymphoma. So complete blood counts, bone marrow aspiration biopsy, some additional blood tests like serum protein electrophoresis and flow cytometry, which again tells you what character of blood disorder. The flow cytometry is very, very important. And what has happened today in 2022 is, which I like to highlight to every one of you, is genomics, because your nose is different than my nose, your skin texture is different than my skin texture, you look beautiful and I don't. Is the reason, simple fact is the genomics. The genes which characterize us also characterizes the disease itself. So these are the commonest tests which are utilized to diagnose cancer, to stage cancer, to individualize and go on to a precision medicine of how to treat you rather than the masses. So again, two great things happened in past 2 decades. One, in India, the number of hematologists or blood cancer specialists has increased by leaps and bounds. One. Second, the revolutionary technology has switched our chemotherapy agents from IV to oral. So that's the biggest revolution which has taken place. All of you are scared of word cancer and chemotherapy. The chemotherapy, believe me, in 2022, 60% has become from IV to oral, and oral has become so targeted so that you don't have hair fall, you don't have loose motions, you don't have vomiting, and those things are not expensive. So dear friends, when we talk about modalities of treatment, there are 3 treatment modalities. One is chemotherapy, second is surgery, third is radiotherapy. Not all require everything. Depending on those 250 cancers which you have in blood cancer, say myeloma, a simple blood test, oral medications are sufficient, and then you require autologous bone marrow transplant. So lymphoma, 6 cycles of chemotherapy is sufficient. CLL, oral chemotherapy, and biggest adventure, biggest revolution has taken place is in the field of CML. Did you ever believe that a person can pop up a pill every day for next 20 years and can survive like diabetic patient or hypertensive patient? Yes, that's the truth. In CML, oral medication has changed and revolutionized the way we look. And since past 22 years, the survival has increased up to 65. So my friends, believe me, these drugs are there to change. And then the biggest thing what has happened in the field of hematology is the bone marrow transplant, which is the pinnacle of all the treatments, leads to 60 to 70% of patients to a cure. So blood cancer, which was uniformly deadly in the era of 90s and 20s, early 2000s, has become curable. 60 to 70% people survive by virtue of oral chemotherapies and targeted therapies along with bone marrow transplant. So let's not get scared with bone marrow transplant. Bone marrow transplant is the ultimate thing which cures people in multiple myeloma, leukemias, lymphomas, aplastic anemias, and lymphoma. So there is a hope for the blood cancer people from 0 to 70, and probably in next decade we will move from 70 to 90% of success for these patients. Yes, prevention is better than cure, as we have all heard, but to be honest, in blood cancer there is no one particular thing like you quit smoking and the rate for oral cancers comes down. There is no one particular intervention where we can say stop this and the blood cancer will not happen. Of course, you have to have a healthy lifestyle, have a good night's sleep, reduce your stress levels, do yoga, all that is good. But what is happening in blood cancers today is pick them early, know about them early, don't push it under the carpet. If you know about them early, we can cure you. We can't prevent it. The only way we say not to have cancer is not to be born. We have all taken birth, friends, but let's make sure if you develop blood cancers, we might not be able to prevent today. Probably another decade of research will help us to know what is causing blood cancers. Till that time, let's pick up blood cancers early. Let's talk about blood cancers. Let's not have a Chinese whispers about blood cancer, because we sincerely at Fortis Noida believe, and this has shown over past decade, that we can cure majority of blood cancers. So stay tuned and talk about on 28th, talk about blood cancer, blood cancer, blood cancer.